Hello everyone, I'm Brian Brooks and I'm a chaplain here at St. Francis Regional Medical Center. And I'm here today to introduce to you the coping kits that we are reintroducing to the patient care units. The coping kit is a toolbox that is designed to empower caregivers to respond to patients who are suffering from the emotional distress that is generalized as anxiety. Anxiety is that battle emotion that arises when individuals feel threatened or lack internal and external resources to manage the unresolved stressors in life. The tools in the coping kit empower patients to transform their distress into a more desired state by teaching them self-care. Unlike when we are administering a pain medication, staff are also receiving a benefit when demonstrating the adaptive tools in the coping kit. We want to respond to anxiety with the behaviors that are in the acronym LOVED, L-O-V-E-D, and we're going to talk about that in just a moment. Remember that the goal in offering patients the coping tools that are in the coping kit is to remind them that they are enough. They are loved and valued, even when anxiety makes them feel like nothing that they or we can say, do, think, or feel is enough. When we embody compassion and lead with grace, we may know that everyone counts and contributes to creating a healing experience at St. Francis Regional Medical Center. However, we must understand for patients and their families that knowing how to navigate their hospital experience creates anxiety. And so we're going to use that acronym LOVED. So L, listen. Listen to the patient narrative for clues that their anxiety is a physical statement resulting from the meaning that they give their current situation or that it requires a medical intervention. O, observe. Observe for signs of anxiety. Things like shallow breathing and darting eyes and agitation and elevated heart rate, frequent requests, irritating attention-seeking behaviors. They all indicate that a patient's safety feels threatened. Regardless of whether you see the danger as real or imagined, patients and caregivers may agree that maladaptive thoughts and behaviors increase anxiety and unpleasant experiences. V, validate. Validate by recognizing and reflecting the patient's distressing feelings may be strengths in another setting. Remember their innate potential to change their current experience by offering adaptive coping tools. E, encourage. Encourage healing by avoiding a power struggle. Instead, offer the coping kit tools as opportunities to adaptively create a new meaning of their hospital experience or take respite in a therapeutic activity. And finally, D, demonstrate. Demonstrate healing by offering choices on how patients may shift their anxious state or bear witness to their courage to be with their discomfort. So now we want to go over the protocol for the coping kits. So as I said, this is the coping kit that will be on the units. On the front, there's a brief introduction to it. And on the inside of the bin, there's going to be the protocol and the outline of the things that are included in it. And now I want to show you the actual contents of the coping kit. The first one is the acupressure for anxiety and stress with the acupressure roller, the KTH roller. Then you will find cards that include information on deep breathing and progressive relaxation. The kit will also include a package of Model Magic. Model Magic can be used to occupy one's hands, create things, express oneself in unique ways when experiencing anxiety. There is also included a set of colored pencils and some coloring paper that staff can give to patients, and they can use that as a distraction and a way to center themselves. The kit also includes a set of playing cards. This can be a good way for them to distract themselves or do something that's very rote, and change their mindset and focus less on anxiety. We also include a finger labyrinth, and on the back is some basic instructions and description of what a finger labyrinth is. This is a nice way, again, of centering oneself or helping oneself calm when feeling anxious. We include a small puzzle block. It looks like a Rubik's Cube, but it's not a Rubik's Cube. It's actually a puzzle, and they can use this. It's a good way to occupy one's hands when feeling anxious. We also are including a journal and some writing prompts. There are 3 short writing prompts that are on this sheet of paper with the journal. People find things like journaling or writing a good way to bring peace to themselves, to relax, and to get focused. We also include a card with information about aromatherapy oils that are available on the patient care units. And there will also be information about self-care that is found on that first sheet that I showed you with the finger roller. All of that is included in the comfort kit, which will be on the patient care units. Thank you for taking time to watch this video, and we hope that the comfort kit will help you in your care for anxious patients, families, and you can even use it for yourself. Take care.